So let's talk about what's out there. What kind of extra tech or approaches are you utilizing, or did you utilize in practice that helped you?
So my personal history includes a spondylolisthesis at L5. So I'm a fellow back pain sufferer. That's a grade 1. And what that is that basically the anterior portion of the vertebra is not connected to the posterior portion of the vertebra. So the vertebral body is not connected to the spinous process, and it's broke at the articular pillars. I probably did it when I fell off of a haystack when I was working on the farms. And essentially, about 3 years later, I was in one of those moments where I couldn't stand up straight. I had excruciating low back pain. I was 19 years old. And the place of employment I was at, the doctor there said, "Hey, you're going to be in a wheelchair by the time you're 50." And this is before I went and started my chiropractic college education. So I know what back pain is all about and the significance of it. So not only did I utilize chiropractic, but I was already kind of a physical fit kind of person, kind of geared towards that kind of mentality. As the years have gone by, I've, incorporated many exercise routines to keep my spine healthy and as stable as possible to avoid as many flare-ups of the spondy as possible. So exercise is a big one. One of my favorites most recently is foundation training. It's a really good exercise protocol, Dr. Eric Goodman. There's many others. There's, the things that people know. There's yoga, there's body resistance, planks and push-ups and pull-ups and resistance training and all those kinds of things, nutrition, just a myriad of different things that you can do to give your body the tools it needs to stay healthy and minimize, these flare-ups and impacts.
So really quickly, let's go into that, because I don't want to skip over that. And I know the listeners are probably saying, okay, I have all this time at home. Maybe I am seeing a chiropractor. Let's talk about movement and diet as being two essential things, that it's not just all in the chiropractor to do everything. As we know, healing starts with you, not with the other person. So when you talk about things like foundational training, movement, or diet, what are some of the recommended things? Again, knowing everyone's personalized, individualized, what are some of the things that you're recommending as far as movement and diet go?
So with movement, going back to the start of a conversation, the alignment, there isn't anything better that one person can do than posture. Mm-hmm. I mean, we are constantly having some type of posture 24 hours a day, right? So posture is a big tool that we can use, and you don't have to be a gym rat. You don't have to subscribe to anything. But if I tell people, if you focused on your posture regularly, how you picked up a piece of paper compared to how you pick up a 50-pound bag of concrete, you'd be better off than many people that go to the gym every day and don't watch their posture the rest of the day, that kind of a thing. So posture is one thing when you consider posture in that alignment kind of deal, but it is a movement reality as well. Positioning, your body and proper positioning and things of that nature does have an impact. It impacts the movement. For you to get your best posture, you basically need to have good movement at every spinal joint. Because that's what allows you to have good posture, is good movement at the spinal joints. If your spinal joints are locked up, you're going to have a hard time straightening up. It's like if my elbow is locked up, I can't straighten it. It's just not allowing that to happen. So we need movement at the spinal joints to allow that to happen. So posture is one big thing. So the other things that you can do, whatever you're doing, whether it's body resistance or cardio or CrossFit or, whatever it is, basically you want your technique to be very, very focused. Try to get good technique. Only go where your technique is good. Don't try to go past that. Mm-hmm. It's the guy that's trying to do a bicep curl of 50 pounds and he should be doing 20 because his technique is really getting terrible at 50. So, movement is really relative to good technique. And stay within your lane kind of thing. Nutrition, it's really easy to throw out what, you should be doing nutritionally, but it's not always easy to follow it. yeah, so you're wanting to be well hydrated. You're wanting to have a good dense, fruits and vegetables and organic proteins and things of that nature. And I know there's the different diets out there. I'm usually that guy that says, hey, if God made it, it's probably pretty good for you. If man has manipulated it in any way, you might want to stay away from it. So the processed foods are not good for you. As much as you can, try to stay away from those. And I'm not perfect at that. So I always follow the old 80-10-10 rule myself. 80% of the time I'm trying to do pretty well on these things. 10% of the time it's not so good. And 10% of the time it's really bad, especially around the holidays when it comes to nutrition. So, and there's good coaches out there. There's good coaches for nutrition. There's good coaches out there for body movement and mechanics. And so getting connected that way is a positive. And I encourage that to our patients, and I do what I can with our patients and work through some of the foundation training exercises that, I really appreciate and really are helpful for pain, but also for stability. Some good techniques.
Yeah, a lot of times it's the simplest of changes, right? Or the simplest of approaches, meaning posture is not a difficult one. Watch your posture. Always be a little bit aware of these things. If you're slouching, if something's off, if you're constantly sitting in the, a kind of weird position for your back and you're feeling it. And I totally agree with you on the diet piece. Everyone wants to find, what should I be eating? And it's like, I think you should just focus on quality and make sure it is coming from nature. Because I posted about today, they have impossible chicken right now and all this impossible meat. And you look at what's in it, it's just soybean oil. It's all this, gluten, everything. It's worse for you. Just eat the meat, right? Eat high quality meat in moderation and just put some time and effort into finding quality rather than trying to make the easy way out.